Great, thank you very much. So good afternoon, welcome and thanks for joining us. We're from the Heads of University Counselling Services Scotland, which is usually probably referred to more commonly as SHUCS. I'm Allie Scott, I'm the Mental Health and Counselling Manager for the University of the Highlands and Islands, and I'm also currently the Chair of SHUCS Scotland, and my colleagues with me today are...
Hi there, I'm Claire O'Donnell. I'm the Student Wellbeing Manager at the University of the West of Scotland.
And hello, I'm Carol Murray, and I'm Head of the Student Wellbeing Services at Heriot University, and it's nice to be here.
So we'd like to start off by thanking NUS for inviting us all. All members of SHUCS Scotland have been working with NUS and the Think Positive project for a long time, so it's great to be here. We're going to be covering student counselling in higher education today by providing a bit of a background and context around student mental health and around university counselling services, together with an interactive exercise to get you talking and considering some of the challenges that university counselling services face, particularly at the moment. The session is based on the knowledge of the member of SHUCS Scotland, together with collaborative work that we've been involved in with the Scottish Government and NUS Scotland over the last, decade, I suppose, around student mental health, and we're hopeful that it'll capture the continual work university counselling services do to redesign and further enhance the services that we continue to offer to address student needs. So yeah, we're delighted to be here and working with NUS and working in partnership with student representatives, so we'll just get started. Thanks, Molly. So student mental health has been getting a lot of media attention, and these sort of headlines that you'll have seen quite often coming up on the newspapers or on social media, and I think sometimes that the press coverage doesn't really give the full picture, especially around kind of the creative and dynamic work that is currently being undertaken within university counselling services to continue to address student mental health needs. So quite often that there's a misrepresentation around some of the news stories that go out there, and they very much focus on the sort of negative aspects of that and the high numbers of increased support, and don't always talk about what university counselling services are doing to address that.
Great, and I think I'll take up the next slide. Yeah, okay. So what we decided to do as a group, the Heads of University Counselling Services, is that we thought it would be really interesting to look at kind of some of the existing literature around student mental health. Our group had previously published a report about 10 years prior, and it had been looking at the demands on university counselling services. Because actually a lot of unis in Scotland have had counselling services even since the 60s. So although kind of student mental health might be something maybe that's in the media quite a lot and feels quite relevant, a lot of these kind of structures have existed, but in different forms for many, many years. So there had been quite a few kind of big reports that had come out, some by the Royal College of Psychiatrists, by people like Universities UK, which are kind of like bodies that really influence the work of universities, because it had become like a sector-wide concern. And we felt that in SHUCS we wanted to look at the kind of distinct Scottish context, because no one had really done that specifically for student mental health. And one of the kind of places that we went to look at the research was the Scottish Health Survey. So that's something that's done every 4 years by the Scottish Government, and they look at lots of different things, but one of the things that they focus on is mental health, so mental and physical health. And what the evidence from the research that they were doing seemed to show was that there are increasing levels of mental distress within young people. So if you look at this graph, you can see that the cohort, the 16 to 24-year-olds, are showing symptoms of anxiety, symptoms of depression, and also kind of have experienced some self-harm type behaviour or suicidality at far greater rates than any other age group. And what we know is that while universities are very diverse places and we have a really diverse population, it still exists to be the case that the kind of median age of students coming into Scottish education falls into this age group. So it's something that is relevant to universities, because probably around 50% of young people now are either entering further or higher education. So we're seeing that this is a kind of population across Scotland, increased rates of mental distress, and then with the numbers of young people that are coming into Scottish universities, it's something that's quite present, and something that we as a group of heads of university counselling services have an obligation to respond to. And universities as a whole, as a community, are also kind of invested in responding to this. So if you just move on to the next slide, please. So university counselling services are the only places in a university that help support students who have mental health disabilities. We also share that work and work really closely with our disability services. So this graph shows that 5 times as many students in universities in the UK are disclosing a mental health disability than were 10 years ago. So we're probably all sick of looking at graphs. I know there's a lot of them in the news at the moment, but I think this graph kind of really is a nice way of illustrating this kind of peak in increased rates of disability disclosing. In the report, we look at this from the Scottish context too, and the figures that were kind of relevant at the time that we were looking at, we could see that since 2009-10, kind of when HESA did their last kind of statistical analysis, and when we wrote our report, which was a couple of years ago, there had been a doubling in Scotland in the disclosure of mental health disabilities, which made it the second biggest disability type of all disabilities that were disclosed. So it's something that's happening in the UK, it's happening in Scotland. And I think that there's lots of different ways of looking at this, but probably for us as a group, we see it as being something very positive. I know CME are going to be speaking later on today, and I think there's been a lot of work around stigma and really kind of breaking that down and ensuring that students feel that they can get support from the university, that the university can help reduce any barriers that there are to studying. So these are the trends, and it's probably something that we imagine will kind of increase, will continue to increase. And this probably is an underrepresentation of the kind of full picture, because there probably does still exist to be students who don't disclose to the university. So just kind of some background there. So if you move on to the next slide, please. Okay, and yeah, why is this important? Well, this is important because there's a really big link between mental health disability and how you get on in your studies. That doesn't mean that students with mental health disabilities can achieve loads and get a really, really good degree or get loads out of their university experience, like they definitely can. But the Scottish Government and SHUCS as a group are really aware that out of all the disability types, and you can see this in the graph, students with mental health conditions are the most likely to drop out of their course. So as a group, we're kind of charged with working with others in the university to try and kind of change this. And I think Carol will speak about some of that work.
Thank you, Claire. Could we look at the next slide, please? So this is another graph, and as Claire says, there's a lot of them around at the moment, but I think this one has a very kind of clear and strong message. And the important bit about this graph for me is that obviously our universities across Scotland, not all of them are represented in this particular graph, but the general trend there is the same across the board, that whatever size of institution we have, the numbers are growing in terms of the demand. And when we compare how many people are coming forward and asking for help, we're seeing that the numbers have dramatically increased, whatever size of population the student population is within each of the universities. And we know that this is coming from a whole range of different areas, and maybe that is about stigma, as Claire was saying, and then breaking that down and people feeling more able to ask for help. But we also know that life, particularly at the moment, is more complicated for students, and that there might be a whole lot of different reasons why people feel that they need to access support. And it's great, we work so closely across SHUCS we share good practice, and we try and understand how we can best manage these trends and how we can make an appropriate response. And I think this is where it's also really important that we have the partnership working with other organisations such as the NUS to get the student voice and try and understand just exactly what it is that's contributing to this huge increase in the number of students who are seeking help. So we can see there that in the example from Edinburgh, the number of students has doubled over the 5-year period. And I think the next set of statistics for the period from 2017, taking us through the experiences we're all sharing at the moment, I think they're going to tell a very interesting story as well. So if we could look at the next slide now, please. I really want us to move on to, we talked about having an interactive kind of experience, an opportunity to hear more from you. And we need to think about what it is we do in order to meet this demand. And as I say, we work closely to try and think about that, but it is really important to include the student voice and to make sure that we're getting the full picture so that we can try and tailor our services in the appropriate way. Could we look at the next slide, please? Thank you. So this slide is really setting out how it is that we've been working in recent times to think about how we really invest in our services and make the best of the resources that we have. And in doing that, we're constantly tailoring that to make sure that we are meeting the needs of students and that everything we do is to the benefit of the students that we're supporting. And of course, we all work in very different institutions. So although we're all the heads of a university counselling service, it's really interesting to meet together and know that sometimes there are different agendas that come from our management. There can be different agendas that come from our teams, and also within the student populations, there can be quite diverse priorities and goals. So it's important for us to use the networks that we have and to make sure that we're actually managing our resources in the best possible way. And so I think this is where the continued commitment to the Think Positive mental health agreement has been a real benefit, because obviously that is working very closely with the students and has enabled us all to contribute to mental health strategies within our organisations and think about new approaches that hopefully we embed within the institutions that we work within, and influence a positive mental health and a different culture for addressing those support needs. We've been hugely helped by that in the last couple of years through the investment from the Scottish Government, where there's been a prioritising of mental health support, which has led to increased provision financially, and really promoting that awareness of the link between student wellbeing and the learning outcomes and just the general student experience. That's enabled us all to recruit more widely into our teams and to think about the range of services that we are offering. I think that we benefit again from that partnership working in terms of being able to learn what is working in different institutions and be able to share good practice. And I think it's fair to say that all of us in our own institutions have really developed and diversified our service delivery so that enables there to be more choice for students. We've moved away from just a very traditional one-to-one counselling support. We now offer ranges of groups and workshops, peer support, and we work really closely with our student representative bodies to promote joint campaigns and to work across the whole institution. We also have a kind of collaborative role, I think, with colleagues across our institutions, so that we are now asked much more of a sort of a consultancy role, where we're able to provide mental health training that's available for staff and for students. And I think a really great kind of development is that mental health first aid is now much more available for students, and we also provide kind of supportive peer programs as well to look at suicide prevention and looking after our friends. And all of this is building into this evidence-based enhancement for working, where the voice of the students and what they need is just such a significant lead in terms of affecting change, and being able to evaluate our services, and get that feedback on what's working and what's not. And I think, again, this is where there's a huge strength in us working together within the heads of university counselling services, because we've been able to look at benchmarking our services. We've been able to work closely in collaborating on how we gather data, making sure that we have parity in terms of some of the systems that we use, so that that data can be really meaningful, and so that we can then feed that back into that continued service enhancement and delivery. I'll pass you back to, I think we're going back to Allie, are we?
We are. Thanks. Sorry, I just need to move my screen about. So I think it's clear to see that we've had, you know, as Nicola Byram says, you know, we've had a surge in numbers of students suddenly presenting to university counselling services. And if we look at it as if it was suddenly presenting at A&E with broken legs, we wouldn't necessarily think that the solution is employing more orthopaedic surgeons. So we need to look at a more holistic approach to supporting student mental health, and that's responsibility doesn't just solely sit with counselling services, but of course we've got a big role to play within that, and a big role to play within supporting our colleagues to also do that. And I was in the discussion this morning, which was really, really interesting, around how we can kind of support more academic staff, especially considering the kind of pandemic that we're in at the moment, to reach out and help students access mental health support and access counselling when they need to. So, you know, there's well-funded and responsive university counselling services are critical, you know, to the response, but they're not the whole picture. And this is where we want to kind of collaborate with yourselves and hand over an opportunity to everybody that's here today to talk about your own views and to think about how university counselling services can respond. Molly, can you change the slide? Thank you. So we'd like to provide you with a reflective exercise. We're going to put you into groups, so we're going to get you into breakout rooms, and we want you to imagine that you're university counsellors. There's 4 of you in the team. You have 17,000 students within your institution, and every year around 400 of those students request counselling. So we'd like you to think about, how do you prioritise student need, and what services would you put in place to deliver to that student need? So a chance to just sit and think about what you might do in this situation. So I'll give you a second just to read the slide over again. And then I think Doogie's going to work his magic and put everybody into breakout rooms. We're going to take about 25 minutes, do we think, Claire and Carol? 25 minutes? 20 minutes?
Yeah, 20 minutes.
I'm smiling away to myself because we got to this point and then I realised we haven't quite coordinated how we might do this bit, but I think it might be useful if everybody turns their cameras on and we have a bit of an open discussion around some of the things that was talked about in your groups. Claire, Carol, give me a nod if that's okay.
Yeah, I mean, yeah, I'm sure my group members would be happy to feedback maybe some of the discussion.
Okay. Would you want to maybe lead on that with your group to start with?
No, I can't see them anymore. Well, actually, my
camera's back on.
My group couldn't turn their camera on because of some technical issues. So,
oh, okay.
But we had some good discussion. I don't know, Shona, do you want? I feel like we've spoken already loads. So
I'm happy, and Gloria, kick in because you had some really good points as well. So I think it was really interesting because I guess we had a really broad range of experience, because in addition to Claire from UWS, we had Gloria from Fife College and the Students Association, and myself from the Open University and with past experience at a BRIC university. And I think by no means all of the points, but some of the points that we talked about was the importance of a whole university approach, so that you're not just thinking about the 4 counsellors, but you're thinking about what maybe the sports facilities can offer. We're thinking about the pedagogy and how you actually embed well-being, if you like, and good mental health into the pedagogical models. We also talk quite a bit about the importance of really knowing your student population to help kind of prioritise, and recognising that everybody has mental health and there's a spectrum from good mental health and well-being through to sort of crisis, if you like. the university can't necessarily do everything, but how do we best prioritize resources? And we talked about some sort of challenges where sometimes counselling is the place people go if they can't find an answer anywhere else, but it could be nothing to do with really what a counsellor is best placed to provide, but that then uses that really precious resource. So how do we find other places for some of those things to go? Sorry, that doesn't do justice at all to a really excellent conversation that we had, but that's some of the points.
I think you said it really well, Sean. I don't know what else to add.
Oh, that's very kind.
Yeah, great. Well, I don't know, Allie, if you want to feedback from your group.
Yeah, I think Laura and Lindsay, do you guys want to come in? Because a bit like Claire, I've talked a lot, so it would be good to get your feedback. I was laughing because Lindsay and I were put in the same group and we're both from UHI, so that was quite funny, but it gave my voice a rest for a while.
Yeah, so I'm from Inverness College, and our counselling team this year, for the first time, we're using one-at-a-time therapy, which has helped to reduce our waiting list substantially. So we triage everybody, we assess risk, and then every student will be offered one appointment, and from that appointment we're hoping to offer them, listen, offer advice and signpost to other support services. And just sometimes it's just general advice for how to get started as life as a student. And then from there, we then assess whether another session is needed, and from there another session. So we're not booking up counsellors' calendars with 6-week blocks of appointments. We're just taking it 1 week at a time. And sometimes once the first few weeks are over and the students settled in, then that's them okay, and they can actually leave the service. But obviously with high risk students, that means we've got a little bit more availability as well to react on the day. So that's worked out quite well for us. And Laura was talking as well about some of the peer support opportunities, which we endorse at Inverness, and she's been organising with RGU. So I don't know if she wants to talk about that.
Yeah. So I'm Laura. I'm a former student. I've actually taken a year out for my mental health. So I was also a student trustee, and what else was I? Advisory on the NUS project advisory, and I helped establish peer support. So our conversation kind of bled into kind of taking a more holistic approach. So obviously there's no one size that fits all. So we were discussing kind of how best to suit those needs, so whether we need to signpost out with the university because their problems are more long-standing than what the counselling service could provide, whether, you know, it's to create workshops for those who are able to take care of their mental health, to better skill set, gain a better skill set for them to help combat that. But as well, I suppose, trying to get that balance between formal and informal care as well. So trying to make the formal a little less intimidating to go into. So for example, you know, the difference between physically crossing a door and, you know, just going online and having that session there within a safe space of your own. Obviously, the whole online physical thing brings up its own issues. But yeah, and also I suppose with like peer support, that informality of kind of having that interim sort of grey area between having a formal counselling session, but also getting that sort of support within a different space with someone that's kind of in the same sort of situation in university, but also of a similar age, possibly, that you can relate to perhaps a little bit more. So it's trying to, yeah, just create that sort of holistic approach, but also trying to get the balance right between not trying to put everyone in the same box and saying this is the package we've got for you, but recognizing that everyone is individual and everyone has different needs.
Thank you for that. Yeah, and I think that's the sort of, there was two kind of key messages I think that came out of our discussion, was that it can't just all rest with counselling, because counselling is not for everybody and doesn't necessarily provide all the answers. So there needs to be a whole institution approach, but the counselling very much does have its place within that, and for those students who really need that support, definitely. But also that we were identifying that maybe, and not so much for UHI because we've had our online service established for a long time, but actually given the current pandemic, we're actually probably meeting student needs a bit more and slightly better, or a group of student needs, because we're providing online services now much more than we ever did. So for those students who found it very difficult to come onto campus for whatever reason, now have access to counselling support in a different way than they've had before potentially. So we felt that we were addressing student needs currently in the pandemic a lot better than maybe we had done before. So that was just something to add. Carol, I'll hand over to you.
I think you're muted, Carol.
Thank you very much. Sorry, I don't know how that happened. So thank you for that. I'm sorry to be putting people on the spot, but Jacqueline or Lara or James, I'm wondering if somebody would like to speak about what we were discussing in our group. Would anybody like to help us out?
There aren't any right or wrong answers.
Sorry, I would, but I've got to leave for another meeting in 2 minutes, so I can't.
Right, not to worry. Well, maybe I'll do a little.
Happy to help out, Carol.
Thank you, Jacqueline.
So we were talking a bit about preventative work and recognising that, you know, a lot of work can take place that's preventative to prevent things getting to crisis point where there is a need for services. So we spoke just around social media and how that can be used quite effectively and in quite a targeted way as well, aimed at linking particular messages to at-risk groups that we're aware of. But we also talked about some of the limitations around that as well, and some of the frustrations at the moment with isolation. And for some groups and for some individual people who are not linked in, that can be a challenge, and it's not necessarily going to hit the mark in terms of helping. And we also spoke a bit about around some of the ideas that people have. A student union member of the group was talking about some fantastic work that they're involved in that's about activity, and their student union sending out bulbs to all students who can then go and plant them around the university in their sustainability week, which we thought was a lovely idea and great for well-being. So I think we were looking at well-being really in quite a holistic way, and about the different strategies that we have available to us and resources from a preventative point of view, but also trying to avoid things getting to the point where we need services. And Carol, I'm sure, can say a lot more about it than I can.
No, that's all great. Thank you. I really enjoyed the discussion, and I thought it was really helpful thinking about when we were talking about priorities and actually identifying that there's a massive group of people that we're maybe not seeing at the moment who are at risk of being more hidden through isolation. And so thinking about that preventative strand of our work, I found that really helpful. So no, it was a good discussion. Thank you very much. Back to you, Allie.
I'm just wondering if we've got time to take any questions, Molly, or if we're just, I mean, it's bang on 1 o'clock now, but I don't think we started until about 5 past, she says, pushing the boundary slightly. Do we have some time to take any questions? If anybody has anything, they can either put it on the chat or just unmute themselves.
Yeah, I'd say we could have another few minutes. If anybody needs to run off to go to other meetings, please feel free. But if you want to stay around for a couple of questions, I'm sure that'd be fine.
Or equally, if you don't have anything to ask or say just now, please feel free to email myself, and we can respond as a group to anything that you wanted to kind of raise. But we're just hopeful that today kind of highlighted the challenges that we are facing and how creative and kind of responsive we've had to be. You know, I think counselling services are really, thanks Jacqueline, that, you know, have been really dynamic in the response, and sometimes we don't always get that kind of I don't know the right word, we don't always get that sort of highlighted, I think, across the network. I think it's always very much about figures and sort of very negative press stories rather than the response that we're doing. I don't know if Claire or Carol want to say anything else.
I think it's been really nice to have the opportunity to come and speak about the work that we're doing, and to acknowledge how important it is to have the partnership element of that. So thank you for the opportunity.
Yeah, thank you very much.
Yep. Yeah, I would just echo that. Thanks to everyone, and yeah, it was really great to have that discussion too. So thank you all.